Welcome to Uncut with Lucia. My name is Lucia Matondo, and welcome back to the final discussion panel here, the RV Book Fair 2022. Please welcome my co-host of this event. She's Pat Buckley. Pat is the author of 6 books and is one of the authors featured in the anthology Relatable Voices. Today, we are meeting with 2 amazing women who work for and with neurovariant children. I'm so excited to be talking about this subject that I'm very passionate about. And we will be discussing the way we look at neurovariance in children today.
We have Dr. Shoshana Living-Fox, forgive me if I haven't pronounced that properly, who's a child psychologist and autism specialist. And she wrote an autism casebook for parents and practitioners, The Child Behind the Symptoms. Welcome, Shoshana. Could you possibly tell us a little bit about yourself, please?
Hi, Pat and Lucia. Thank you so much. Yes, I am a child psychologist, and I'm originally from the States. I'm also a play therapist, which was my subspecialty when I was learning about child psychology, and gradually became an autism specialist over the years. I'm not sure to what degree you want me to go into it, but basically my personal journey has led me from small town Ohio to Boston, to Israel, to Vancouver, British Columbia, and back to Israel, where I am now. That's in a nutshell, and I can expand on that later if you like. I've been all over the world, so if your brand sort of has this van, this traveling van, I go, okay, yes, I can relate to that.
Mm-hmm. Yes, and welcome to our program. I think it will be so like something so important today because we'll be talking about diversity, and I was super excited about this panel. And today we also have Shelley Cannell. Shelley is an individualized education plan consultant, or IEP, and educator who wrote the book Those Who Can't Teach. So, Shelley, welcome to Uncut with Lucia.
Thank you very much. And this is our 3rd time together. So 3rd time is the best time, I'm going to say, because I have not met these other 2 wonderful women, but I am very excited to be on here with you both and to learn more about what Dr. Shoshana does. And myself, as Lucia said, is I am an IEP, or an individualized education program consultant or coach. Here in the United States, we have the special education system, and the IEP is what drives that special education process. And I have been a teacher, I have been a substitute, I've been a paraprofessional, I have volunteered in schools. I have lived in England for 3 years, visited multiple places. Unfortunately, have not been to New Zealand or Israel, but 2 places that I would like to visit at some point. So maybe if I ever make it to either of those places, I'll have to meet up with these 2 wonderful women. And I have just loved traveling and loved learning about kids who learn differently. And that is truly what I believe, is that the neurovariants, the neurodiverse, the people with disabilities, whatever language it is that we use, that they truly just learn differently. And it's not an inability to learn, it's a different way to learn. And I can go more into my story too a little bit later, but my story truly is the first chapter of my book. So I don't want to tell too much because I want people to get the book and read the book.
Yeah. Thank you so much, Shelley. I think I'm really going to enjoy this discussion today. You're both very fascinating women, talking about a subject that I personally know very little about. So it's going to be great. Thank you. Let's start this conversation with how you both got into this field. Shoshana, how did you get into children's psychology and specialize with autism?
Okay, well, I think to tell you the truth, I think a long time ago when I took my first psychology course as an undergraduate, I was hoping to understand my family of origin, and it didn't help very much. It was a great disappointment, but fortunately things got better. And I was always interested in children, always had great respect and affection for children. So that was the child psychology part of the equation. Within that, I was always interested in how play could be used to reach children. So I did a subspecialty, and when I was doing my doctorate at the University of British Columbia in play therapy with a wonderful mentor, Dr. John Allen, who's really very, very special individual. And that attached later, in terms of autism, so that was the child psychology and the play part of me, which is a really, really important bridge to working with the autistic children. I was always interested in autism. I was always fascinated by the children with the autism diagnosis. I was always kind of drawn to them, had an affinity. And the turning point came in about 1992 when I had finished my doctorate and I'd applied for a postdoc, and then miraculously got a postdoctoral fellowship from SSHRC, which is the Social Sciences and Humanities Research Council of Canada, which enabled me to approach Professor Reuven Feuerstein. Don't know if you might have heard of him yourself, Shelley, a great genius he's now unfortunately passed away, of a psychologist, completely non-conventional in Israel. And I approached him and I said, if I get a SSHRC postdoc, can I come work at your institute in Jerusalem? And he said, absolutely, just like that. And so when I got the SSHRC, I went, and first I did some research in autism. At heart, I am not a researcher. I did it because I got the grant, and it enabled me to start at the institute for a couple of years. And like the man who came for supper and stayed, I worked there for 25 years. And my specialty was assessing and treating autistic children, but not with conventional tools. I used play to assess them. I'll tell you a little bit more about that later. So for the last, I left in 2017 after 25 years there. And as soon as I left, I thought, I've got to write down what's happened, because so many children were changing. And that was the impetus for the autism casebook. So those are all the pieces of the puzzle, and it's been quite the odyssey.
Thank you.
Thank you.
I love unconventional methods.
Oh, absolutely. Absolutely. Yeah, that's the only way.
Yeah.
For
And Shelley, for you now, how did you first get started with IEP?
Well, it's kind of a roundabout story. When I was 9 years old, which is third grade for me, I loved school, absolutely loved my teacher, and I wanted to go into teaching students in the general education population. At the time when I was in that age range, there weren't really special education students in our districts. The law had just passed here in the United States that we needed to educate everyone, no matter their ability levels. And there was still they were kind of stuck in outside buildings attached to schools, or in very tiny classrooms, almost like your custodial closets, or, like a broom closet of some kind as far as the size of the room. And so I never saw any students who were different than me as far as the way that they learned. And so at that time, like I said, I wanted to be a gen ed teacher. Well, my school, a little bit like Dr. Shoshana, I grew up in a very small town, and all of the kindergarten through 8th grade students were in one building. And so when I was in 8th grade, I had a study hall, and I chose to take my study hall time and go back to my 3rd grade classroom and help out in the classroom, because I still wanted to be that teacher. And on my way back to that 3rd grade classroom, I passed a door, and I noticed people on the other side of that door that I hadn't ever really noticed before when I had been down in the 3rd grade myself. And so I asked the teacher what that room was. And she said, well, that's where the special education students go. And I said, well, what's special education? And she said, well, those are the kids who can't learn, or they can't get around like everyone else, or it was just a lot of, they can't, and those kids. And so I guess from that, I started to develop this idea that students who learned differently were those kids, which is why those is in quotation marks in my title. And I had this thought come into my head that instead of teaching gen ed, I should teach special ed. And I just pushed that thought aside very quickly and said, oh, I don't know anything about those kids. I'll not be able to reach those kids. And then I get into high school, and we have something here in the United States called the Special Olympics, and it's now international. At the time, I don't know if it was, but they had this event, and I went and I volunteered, and I thought, this is really cool that they have this for those kids. And that population of student who learned differently than I was always those in my head, because that's how the population had been presented to me. And again, in high school, the thought came to me, teach special education. And I pushed it aside again and said, I'm not going to have anything in common with those kids. I'm going to feel too sorry for them. I'm not going to have high enough expectations for them. And then I get out of high school and I realized, I think I want to be a teacher, but I want to find out what it's like being on the teacher side instead of on the student side of the desk. And so I got a job as a paraprofessional right out of high school, back in the same district where I had attended school. And so I started working, and the teacher would give me the students who were struggling with reading or struggling with math, and I would help them out a little bit. And I did that for a few years, met and married my husband. We moved overseas, and I found myself subbing over there. And I had been in a couple of classrooms where I had students who had some behavioral challenges. And then my final year overseas, got a job as a kindergarten full-time assistant to 5 students with individualized education programs. And prior to hearing that title, I hadn't realized that all of those children that I had worked with leading up to that point were those kids. And I had fallen in love over all of those different experiences with those kids, quote unquote. And so then when we came back to the United States, I restarted my college career to get my special education degree so that I could become a teacher to those who learned differently, because they were no longer those kids to me. They were now the kids who learned differently, and finished up my degree, then taught full-time for 15 years. And about in 2017, which was really interesting, that's also when you left, Dr. Shoshana, is when I left teaching full-time and have become this education consultant, master IEP coach. And I'm helping directly multiple families at one time instead of just a few students in my classroom at a time.
Congratulations.
Wow, I have to say, I'm just blown away by this. This is just incredible. You can probably tell by my accent that I'm English. So I spent the first 59 years of my life living in England. Only emigrated when I was 59. And I grew up in a very little rural English village back in the 50s and early 60s. And I never saw I went to a small school. I never saw, as you said, Shelley, I never saw those other kids because in those days they were mostly institutionalized or kept at home with their parents, never allowed out. What would people think? I mean, when you think right now, it makes my blood run cold just even talking about it. And I also remember the outcry, maybe, I don't know, late 70s, early 80s in the UK, when they suddenly decided to introduce those kids to mainstream education. And everyone it wasn't well received at all. Oh, it will affect how our kids learn. Oh, this is dreadful. And I remember, I mean, I wasn't in the education world, but I remember being horrified, thinking, but they're the same as us. Why are they not allowed the same opportunities? So for me, on a personal level, to hear you ladies speak with such passion it's making my heart sing. So thank you very much. Okay, now we're going to talk about conventional methods. Something you both have in common is how there's a need in our society to break away from some conventional methods we've used in the past. Shoshana, you mentioned this when it comes to psychology, specifically also how autism is diagnosed. Can you tell me a bit more about this, please?
Oh boy, have we got about 3 or 4 hours, Pat? That would be great. No problem. I hope I can sort of shrink this down. It's a topic that's close to my heart because during those 25 years that I was at the Feuerstein Institute and assessing and treating children, but not using the DSM criteria. And I'm assuming your listeners know the DSM is Diagnostic and Statistical Manual of Mental Disorders. We'll talk about that in a minute. And not using tests with norms and numbers. I was playing with the children using DIR floor time, just sort of extrapolating from my play therapy background and getting so much developmental information, so much more than the children's symptoms. So in terms of diagnosis, what I was finding out is that a lot of these children, most of the children who came to me, and I saw thousands over 25 years, there must have been several thousand children, 100 new ones at least every year, plus the old ones, plus. Most of them had been, well, almost all of them had been diagnosed in very respectable clinics and so on by very high-ranking experts and so on, using the DSM-4, using the DSM-5, and then these kids would walk in, and after a while, I'd read the referral information. They say, this child is autistic according to the DSM-4 or according to the DSM-5 and blah, blah, blah. And I thought, wait a second. I want to know who this kid is because there's a problem here. I put the diagnosis aside. I see we have a lot in common, Shelley. We really do. We really do. And I would say to myself, I'm going to meet this kid and find out what this child is all about. And getting back to the misdiagnosis, in a huge percentage of the cases, I found out that these children were not autistic at all. They had autistic. I'll qualify that and I want to explain that. It'll only take a few hours. It's okay. Don't worry about it. That they were not autistic at all. They had all kinds of problems, most of them. Some of them were genuinely autistic. Others had all kinds of other problems, emotional problems in varying degrees, oral dyspraxia, where the brain, mouth muscles, facial muscles are not hardwired, and they've been mistakenly diagnosed as autistic. Children with all kinds of hearing problems that affected their language development, and no one had connected the dots to say, wait, this isn't autism. Now, why do I say misdiagnosed? 80 years ago, the criteria for autism were really tight. They were really, really tight and very clear. Extreme emotional cutoffness, and a kind of obsessive insistence on sameness, and the kind of stereotypical behaviors of flapping, walking in circuits. Now you have what's called a spectrum. And let's think about that for a minute, as I do in my book. When you have a diagnostic criteria that are called spectrum, what are you saying? If you have a cough and you go to the doctor and say, okay, that's easy. You've got coughing syndrome. You've got coughing spectrum syndrome. And you say, well, doc, I want to know, do I have a cold, bronchitis, God forbid, lung cancer, an allergy? What is it? It's coughing syndrome. That's what, in my estimation, is being done to a lot of children who do have all kinds of developmental problems. But because the criteria have been stretched, where they used to be really tight, they've been stretched, they're elastic now. It's become a one-size-fits-all diagnosis. And of course, the numbers, wouldn't you expect it? They're skyrocketing. And some of those people with those diagnoses must be truly autistic, and many just have what is known as in the field autistiform. It has the form of autism. It kind of looks like, that's all it means. It sort of kind of reminds me of autism, but it's not the real thing. That distinction has been lost in the field. So where I was working, we did not lose that distinction. So conventionally, I think right now the criteria for an autism diagnosis are just so wide that gazillions, you should pardon this sophisticated term, gazillions of children are being diagnosed as with autistic spectrum disorder. Meanwhile, underlying difficulties that developmentally have impacted on them are being overlooked or discounted. And the heartbreaking part of it is, there are a number of heartbreaking parts of it, their strengths are being overlooked. So that's what you need to find. Because if you can find those strengths, then you can help the children change. And lo and behold, what the child looked like a year ago could be really, really different a year, in the present, because you realized this is a state and not a trait. The diagnosis is not a determinant of who the child is. It's like, okay, maybe yes, maybe no. Who's that kid? So yes, I think that the current way of diagnosing, in short, Pat, to return to your question, the current way of diagnosing children is disastrous. If I can continue for another couple of minutes, I would say that the impact on parents, a child that has an expressive language problem, a language processing problem, a lack of confidence, social difficulties in social situations these days, I don't think they're at risk of being autistic. Some maybe in extreme cases. They certainly are at risk of being diagnosed and labeled as autistic. And when that happens, the fine distinctions of who that child really is are kaput. They're gone. Where does this take the parent? On one hand, sometimes, and I believe I've supported parents for at least 40 years of my career. I mean, supporting parents is a huge part of the work. But I would get parents, I felt like I had to pump them up when they would come and say, well, there is hope. I'd look at the child and I'd say, there's so much that can be done with your child. Let's go for it. Oh, but he's autistic. And they're really, really suffering. So the impact of a diagnosis, let's say a misdiagnosis, is as profound as a correct diagnosis. And I will say, even when a child is genuinely autistic, and I use that term to refer to those old-fashioned criteria of 80 years ago that are really, really tight and really, really clear. And the others may have a name or they may not, but more important than knowing the name is understanding what's going on with the child, and using all kinds of creativity to help the child change. And I hope that answers your question, Pat. It's very, very close to my heart. And I just saw so many of these children change meaningfully, and their parents too. If the parents had, many of them did, have the energy and the stamina to hang in there through some of the early parts of the work. And when they start to see changes, then the parents too kind of perked up and they realized there was hope. And the diagnosis didn't have to determine who their child was. So there you go.
Oh, sorry, Lucy, I know it's short term, but can I just
please.
Thank you so much for that answer. I mean, obviously, I'm a completely lay person. I know nothing about the topics that you're discussing other than from an observational point of view. But you kind of said something that has always been in my mind. How come there's suddenly so many children that all have these labels? Autism, ADHD, is that another one? There's so many. And just as somebody who's not a medical person, who's had no training, I didn't even go to university, even I think, well, can that be right? Is it not just quite convenient to just stick a label on somebody and, okay, you're done, you're autistic,
Right.
let's move you out of the side.
100%, Pat, because we have these elastic diagnostic criteria. When you've got elastic diagnostic criteria, you can pop anyone. And as I pointed out, the danger is, well, many of these children do have developmental problems. And then you think, oh, great, now I have a name for it. But do I understand what's really happening with the kid? A lot of times not. And that's a big problem.
Yeah, it's very reassuring for me, and probably all of Lucia's millions of listeners, to realize that there are people like you out there who do have the common sense and the wherewithal and the training to actually put all that to one side. So thank you. On a personal level, thank you for that.
Pleasure.
Lucia, it's your turn.
No, and I've been treating kids with many syndromes, and also autistic kids with autism. And one day I was treating a girl, and their parents told me that she had Asperger. And afterwards, we find out that this kid had she had
Right.
sensory problems that
That's right.
treat in a different way. And
Absolutely.
I don't know how, people come with some with diagnoses that you said, no, these kids, they just need to be reevaluated. And also,
Absolutely.
we need to try different forms of treatment. We cannot only be treating these kids like they are all the same, or they have this.
That's right. Cookie cutter kind of mentality.
That's why I love unconventional treatment. So, Shelley, you speak about this when it comes to education and how children are taught in class. Can you tell us more about some common issues you've noticed in the classroom when it comes to neurodivergent children?
Yeah, absolutely. And so much of what Dr. Shoshana said was resonating with me. And I get the great pleasure of, in my teaching career, I have worked with every eligibility within our special education law here in the United States. And there are 14 eligibilities. And I felt that there were certainly areas that were misdiagnosed. And I think that those misdiagnoses tend to carry over into the classroom, because teachers then have a set idea in their mind about what somebody with autism looks like, or what someone with ADHD looks like or behaves like, or what somebody with Down syndrome or someone in a wheelchair is capable of. And so their perspective, when someone is given a label, is narrowed down to their knowledge of that label. And they truly forget that the person is a person, not whatever that label is or that eligibility is that they've been given to receive special education services. In my experiences, kids who there's two different kinds of disabilities. And by that, I mean they are invisible, which means you don't see them when you look at the person, or they're visible, which is you can see it when you look at a person that maybe they're in a wheelchair. So you see that disability. Maybe they're using crutches. Maybe they are, there's some facial features, or they're missing a limb, or there's, damage to a body part. So you can see that. So it's a visible disability. So those two classifications are what I think is a huge difference in how people treat those with the disability. So in my experiences, it had been that the kids that I worked with, that I know, who have the visible disabilities, people had too low of expectations for them many times, because they saw someone in a wheelchair or they saw someone nonverbal, and they instantly think that that person's intelligent levels are much lower. But then they would see a child who has an invisible disability like ADHD or a specific learning disability or some other health impairment like autism, and they would think, well, oftentimes I would hear, well, the child is faking it. They were able to do the lesson today, but they can't do it today. So because they could do it once, they obviously have control. So they're obviously faking their inability to get these things completed or to understand them. And so the perspective is very much tied to what that person thinks about that eligibility under the special education law. And one of my, it's a strange thing to be proud of, but when I took my special education certification tests, I had to take multiple throughout the years, and I scored extremely high on everything except the assessment for being able to be given characteristics and know what eligibility those characteristics would fall under. I actually failed that section of my assessments. You had to have a 70 and I had a 69. And I am just like Dr. Shoshana in, I don't look at the person as their eligibility. I look at the person individually and I learn the person. And then I go, okay, how do we work with this child? That's where the creativity comes in that Dr. Shoshana mentioned, of figuring out, okay, I've tried methods A, B, and C, and they're not working. So now I'm going to try D, E, and F. Maybe part of one of those worked, but not as complete as I thought. And so then I would try H, I, J, and I would just keep going until I found things that worked with my students. Now, I didn't have my students all on grade level, but I had a lot of them on grade level by the time they left my teaching area and went on to other special ed teachers or other gen ed teachers. But I had teachers tell me, because I had some students in my one area that had the most severe disabilities in our school district, and they were the obvious, the visible disabilities. And I was told I was wasting my time trying to teach these kids how to read, and that I needed to really consider their life expectancy and teach them more life skills. Right, Dr. Shoshana? These are educators.
I must tell, I'm so relating to this. I'm thinking, why didn't you come work at the Feuerstein Institute in Jerusalem? You would have fit right in. You would have loved it. We were going gung-ho for potential, but I don't want to, it's too, if I can share an anecdote, I'm sorry to intrude on your
no, you're fine.
Kind of thing, but years ago, when I first came to Israel for the postdoc and the research and then state and working with the kids, which is really much more meaningful to me. I was working at a school which will remain nameless here in Israel, which was particularly for autistic children. And they were using a method which shall remain nameless, but it was very mechanical and it was pretty insulting, I thought, to the children's abilities, kind of treating them like robots and so on. And I was talking about, well, let's teach some of these kids to read and let's take them out and run around and let's play with them and let's do music with them and let's have fun with them and let's get them alive. And the principal would say, well, because what were they doing? They were learning how to slice vegetables to make salad. And I said to the principal, I couldn't wait to get out of that school. I got out of it as soon as I could. But I said to the principal, this child is 6 right now. I said, if he reaches the age of 18 and hasn't learned to do anything else, we can teach him how to slice cucumbers, no problem. But so I'm very much sorry to interrupt, Shelley, but I'm so relating to what you are saying. Yeah.
No, yeah, that's yeah. And like I said, it's that expectation that because these teachers could see the students' disabilities. I had
Right.
one who used a wheelchair to get around. I had one who, I had three who were paraverbal. They had some communication, but not enough that anyone could understand them at any time. And, and so because of those things that the teachers saw, their expectations academically were extremely low. And so something that I have done, and I'm going to do a shameless self-plug here, is that I do have my own podcast called #NoLimits, because I am trying to change that perspective. Every week on my podcast, I interview people who society has placed limits upon, but who have busted through those limits. Because I truly believe that until people have those experiences with someone who learns differently from them, and that's totally based on the story of my life that I shared earlier, it wasn't until I started working with people who learned differently that my perspective truly changed. And I think that's what it's going to take for society in general to really understand looking at the person's abilities and not some label that they have, not some diagnosis that they might have.
Absolutely.
You don't look at somebody with cancer and think, oh, well, that's all they are. They're cancer. They're a cancer patient. No, that's a person. That's a mom. It's a dad. It's a brother. It's a sister. It's a student. It's whatever. And we need to do the same thing with someone who learns differently from us. It's not autism. They are not just autism. They are not just unwanted behaviors. They are not just ADHD. But I've had school districts push labels on students, and then they've said, that's because when our teachers read the IEP and see that it says ADHD, they'll know what to expect. No, you don't. You don't know what to expect any more than two people who have lung cancer and how they respond completely differently to the treatments, or what what the level of that lung cancer is. And so trying to get that perspective, trying to reach people's hearts for them to understand this person is a person. And it makes me laugh, but it also angers me that our special education laws here in the United States, each one of them, the law and the document start with the letter I. The Individuals with Disabilities Education Act is the law that we fall under for special education. And then it's an individualized education program. But yet so often people want to still clump everyone together who has an IEP or who receives special education services. And we're not going to change things for the better for our students and in turn for our society until we focus on the I in the IEP and in IDEA.
I told you this panel would be fantastic. And I have to tell you that as a physical therapist myself, I always, when I was doing the evaluating the kids, I used to see what they are able to do and not to see what they cannot.
Yeah.
It's, I think we should focus on the progression, not what are the problems. The problems are not important. And I just love the way both of you understand the fact that we are not the same. We should not be labeled. And this is fantastic. So Pat, please, it's your turn. I'm so happy.
I just love all this passion that's flying around the room as everyone's speaking. It's just wonderful to be part of. Shoshana, what's the biggest misconception that you've noticed about the way that children are perceived?
I'd like to focus on how it's very similar to what we've been talking about. For me, because I would say the last at least 25 years, and actually quite a bit more that I'm not prepared to admit to, I've been involved with autism. So I'd like to, if you don't mind, for my part of the answer, Pat, I'd like to focus on how autistic children are perceived. And it really, really resonates with what you were saying, Shelley. is they're not perceived. They're perceived once you've got that diagnosis. They're perceived through the lens of the diagnosis. Their individual strengths are a lot of times overlooked. Their individual underlying issues are not well treated or related to, and so on. So I'm not speaking about children in general. In general, if you ask me about children in general, and then I want to get back to autism because that's what I've been living for so many years. But in general, I think we too often forget just the simple fact that children are people, and they're deserving of respect, and they're deserving of respectful, even when they need to be, perhaps particularly when they need to be disciplined. It's about love, it's about feelings, it's not about behavior. But back to autism, I think the label has become extremely damaging because it appears to offer an answer, but it really just offers a cover-up in many cases. Some children are genuinely autistic, but certainly I don't buy into all the numbers that are flying around these days. I think that's pretty well what I have to say about that point. Yeah.
Thank you.
Thank you.
And Shelley, do you agree? What are your thoughts on this?
I do agree. And yes, to expound on that, one of the areas that I fell in love with and am still very much in love with when it comes to special education needs is behaviors. And you talked about that, the discipline part of it. All behavior is a communication. What is that behavior communicating? And we have children who have some disruptive behaviors. And I classify behaviors kind of in the similar way that I classify disabilities into two sort of main categories, wanted and unwanted. There really aren't a lot of behaviors that are right and wrong. They truly are wanted and unwanted. And there are a few, don't get me wrong, there are some, behaviors that are definitely wrong in all societies, I think. But if you think about your own personal desires, what you think the word, for example, respect means. We have a really, really bad habit of saying to our students, be respectful. We, in our heads, when we say that, have an idea of what that looks like. But our students don't necessarily have the exact same idea in their head. And so suddenly a student is getting into trouble for not being respectful because the teacher or the person, the adult who said be respectful, never explained their full expectations and definition of respectful. This is a story I teach teachers on behaviors and how to handle them in their classrooms. And this is a story that I use in those lessons is sticking out your tongue at somebody. My daughter and I grew up where my mom and I would in play and in fun, just kind of stick our tongue at each other in a joking kind of a manner. My daughter and I do the same thing. Now there has been once or twice in her life where she was angry and she stuck her tongue out at me. And that was a completely different situation. And she and I had to talk about that. But for the most part, we do this in jest and in fun. We were at a family gathering. We were joking. She stuck her tongue out at me, which was very normal for that type of setting. And one of her uncles got really, really angry and upset with her and scolded her because how dare she be so disrespectful to me? And this brings it back to the wanted and the unwanted. I was okay with that behavior. It was a wanted behavior, in my opinion. In his opinion, it was an unwanted behavior because he saw that as disrespectful. And most behaviors are that way. If a person is in one setting, in a classroom, for example, sharpening the pencil, for some teachers is fine. Kids can get up and do that as often as they want to, and it doesn't bother them. So they're not breaking a rule sharpening a pencil in that class. They go to the next class, and it is a rule in that class that they are not allowed to sharpen their pencil during class. So it's not that sharpening the pencil is wrong. It was, well, this teacher's accepting of it. and the other teacher wasn't. So it's a wanted, I'll accept that, I can handle that, I'll tolerate that, whatever you want to look at it. And so behaviors definitely are that wanted and unwanted categories. And we do a very poor job as adults explaining, because sometimes we don't know what our own expectations are until the expectation is broken. And then the child gets in trouble and oftentimes is very unclear as to why they got into trouble. So kiddos that start young with behaviors get that label all the way through. And that perception then from that day forward, when that student walks into a new classroom, is I have this student, and that it's a negative connotation. And oftentimes, if not at all times, when you look at special education, whether you are the person with the special education need, or you're someone in society looking at somebody with special education, it has a negative connotation to it. It's perceived in a negative way, like, oh, I feel sorry for that person. You don't feel sorry for people that you're happy and excited for. You don't say, oh, they just got a home run, I feel sorry for them. No, it's when it's something that's sad to you. So we think that disabilities are a sad thing, and they aren't necessarily. The things that I have learned from people that I know who have learned differently than myself are absolutely incredible. And I don't think I would have learned those types of lessons if it hadn't been for the person who learned differently from me. So I don't look at people who learn differently from me as a negative thing, but most of society does, I think.
Yeah. Tell us first, Pat, what you want to tell.
No, I don't really have anything to say. I'm just in awe of you ladies. I think you're doing amazing jobs. Yeah.
I have an idea.
Sorry, if you want to.
We should make a convention in Jerusalem, and then we all go there. I will talk like as a physical therapist, Shelley as an educator, Dr. Shoshana as a psychologist, and then yeah, we can all meet, and Pat will be there also, just being Pat. Like,
yeah.
I'm actually really fascinated in this discussion. Excuse me, how Shelley, you and I have come to such similar conclusions. Okay, I'm more in the field of autism, but definitely so many commonalities. You coming from the education field and myself from psychology, but there's just so many powerful commonalities in our work. Yeah. Very interesting. Yeah.
This is amazing. I interviewed Shelley, now it's our third time, but I knew that you the same way too.
Yeah, you were right, Lucia. You were really right.
You paired us well.
Yeah, it was good. Yeah,
good. Lucia has, I think, a magic art. She interviews people once and then she knows how to pair them together. I've done, I don't know how many interviews we've done now, like so, over the last month. Everyone has been remarkable. There's been magic in everyone just because of her pairing. She's very clever, very clever. I'm very impressed. Anyway, moving on. Shoshana, what's your advice to parents about communicating more effectively with their children?
Okay, so I hope you won't mind it. You won't be surprised if I take it to communicating with an autism. I'm going to call it an autism diagnosed child, because not all children with that diagnosis are genuinely autistic, as you all know by now. Okay. And this, I want to give credit where credit is due. I definitely learned working at the Feuerstein Institute. I'm going to spell that because people probably think it's F-O-Y, but it's F-E-U-E-R-S-T-E-I-N. And Professor Reuven Feuerstein really was a completely unconventional and courageous psychologist. And I'm just saying that to give credit where credit is due, because I learned this from him 25 years there. He was a great teacher and was always very demanding of his workers, but always raising the bar and always teaching. And one of the most important things I learned and shared with parents of children diagnosed with autism is, wait for it, talk to your child. Now, say to parents, do you talk to your child? Oh, no, we were in fancy schmancy clinic and the doctor said, don't bother talking. This is a true story. We don't bother talking to your son because he doesn't understand language and he's never going to talk. He's never going to speak. And my colleague, speech therapist, was really gifted from Australia originally, hit the roof and said, oh, yes, you do. And this is what I shared with parents all the time. I'd like to expand on it because it's just so important. Because this is partly the impact of hearing a diagnosis, whether it's a misdiagnosis or inaccurate. Parents feel so discouraged. Well, okay, so like language is not going to happen. Okay. No, talk to your child. Okay, so then the question arises, what do you talk to a child with about who's not answering you? Or if they do answer you, they're echoing you, echolalia, they're repeating what you said. You know what you talk about, and it sounds completely like illogical, but does it work? And there's some research behind this too. You talk about what's happening. You talk about what's happening in yourself, mom. You talk about what's going on with the kid. I'll give you a few examples. You talk about the child's feelings. So that's probably the single most. I would like to give you some examples, if I may. So, for example, I'd say to the parent, I'll share a wonderful example, actually, of, this is in the book. Actually, I put this one in the book because I wanted the cases to show people how much you could move away from a mindset about the diagnosis into one that's focused on the abilities of the child and the ability of the child to change. So, 3-year-old child comes in, probably one of the few that I would say really had kind of a classical autism. 3 years old, not speaking, terrible eye contact, looking in the mirror. The rest of the world had just disappeared. And mother was extremely depressed. She came alone. Usually I had insisted on both parents. Father was so upset, he's delegated it to mom. And I want to use this as an example of talk to your child. And she came in and she's very, very depressed. And I want to give parents practical things. I mean, that was part of the work. I didn't have a checklist of symptoms. I'm not using the DSM or any of those other checklists. I got down on the floor. I used DIR, floor time, and I would play with the child, sensory play, bodily play, tickle, lifting the child, rocking the child, peekaboo, starting way down in baby level just to get that contact. And then we can pull it up, teaching the parents also how to play, but the talking part, I want to stay with the talking part. And I was telling this extremely depressed mother, I said, it really helps if you talk to your child. Talk to my child. What do I talk to? Talk to him, I tell parents, be the voiceover in the documentary of your child's life. You're the voiceover. So you say things like, well, let's see, I can't decide whether or not to give you your yellow polka dot shirt or your purple polka dot shirt. I think I'll put your purple polka dot shirt, which is how moms talk to the other children anyway. So I said, do it with your so-called autistic child. Maybe yes, maybe no. Do it with this non-verbal child. Talk about feelings. Oh, the water was too hot in the bath. You're crying. You didn't like it. Mealtime. You know what? I'm going to give you some peas and some carrots. First of all, it's good for morale for the mother. There's a child in there. Mom, you can talk to them. I want to talk about the effect in a minute. So talking about what's happening around the child and also about the parent. I mean, doesn't every parent do this? You're in the kitchen, you're going to make some muffins. You're talking to yourself. You're saying, well, let's see, I need some bran. And oh, am I out of whole wheat flour? Oh no. Oh, sweetie, I'm just going to run to the store and we're going to put some raisins in. Talk. But with the child who's been labeled autistic, sometimes, too often, that shuts down. What's the impact of this? If the parent can do that, as much as possible, I'd say to moms, particularly moms and dads, without draining themselves. If you start to feel drained or resentful, stop. It's okay. You need to take care of yourself. You've got a lot on your plate. But when you can, just talk. And then I would teach them what to look for. Improved eye contact, more sounds. Let's say mom's saying, oh, where did I put my wallet? Gosh. Oh, here it is, sweetie. I found it. It's right here inside my purse where I left it. And the kid goes, not a word. That child has responded. And I would teach them, saying, right, isn't that great? I found it, because you got to get the mechanism. You got to get it going. You got to get it fired up somehow. So back to this particular mother, very, very difficult situation. I only saw the child 2 or 3 times, and then I'm afraid the powers that be and the powers of the diagnosis and their hopelessness of the situation. So she thought, got to the family, and I never saw the child again, but did come in another time. And so I was teaching her about the importance of talking to your child, your autism diagnosed child, and giving her some pointers about that. And about 3 weeks before her appointment, I recognized her voice on the phone, and I was sure she was calling to cancel the appointment. I was sure of it. Couldn't quite. It made me feel so sad when I could see the potential of the child, and somehow it would slip away. Couldn't quite get a bead. Really, really tried. But to my surprise, this depressed mother said, I've been trying to do what you said. It's not easy. I've been talking a lot to my boy and to myself and just describing stuff. And I think he's babbling more, and I think his eye contact's a little better. And she said, see you in a few weeks. And sure enough, when that child came in for his second appointment, his eye contact was better, and he was babbling more. So the impact of this, it creates a kind of surround sound, if you will, opens up the auditory verbal channels. I can't take credit for creating the method. That goes to the late professor. To say that it works, wow, does it help? You need coaching along the way. So for parents that are listening, it does require coaching along the way. What do I do with it? My child starts to babble. What do I do with that better eye contact? And that, of course, can't be answered in a forum here, but talking to the child is just so important if there's going to be a hope of language in that child.
Thank you.
Thank you. I was crying because I remember it makes me remind about my patient, so I got emotional. Yes, it's very important to talk with the kids. And so, Shelley, how do you approach the parents during the IP meeting? I know it can be difficult because some parents are not prepared to this meeting. So please.
Yes. And I just want to piggyback on Dr. Shoshana. When you're talking to your student or when you're talking to someone, again, especially someone who you think may have a lower intellectual understanding than what they probably really do, speak to them at an age appropriate level. If you meet someone who's in a wheelchair and they look like they're in their 20s or 30s or older, speak to them as a 20 or 30, speak to them as an adult. If you see a child in a wheelchair, speak to the child like you would speak to any other child. But I've had too many, and I know this doesn't answer your question, but I just really wanted to say this. I'll get to your question in a second, Lucia, but that was just something that always used to really bother me when I would see people talking to my student who was in a wheelchair as if he was an infant because he didn't speak and he was in a wheelchair. And I made it a big point to make sure that they heard me speak to him as a 10-year-old, as a 12-year-old, as a 14-year-old, as an 8, however old he was whenever I was speaking to him, because he wasn't a baby and he deserved the respect, as you mentioned, of being treated like the person that he was at his age level. So that kind of does lead into how to treat parents at an IEP meeting, because they should be treated with respect. The law states that they are equal members of the IEP team. I'm not a lawyer, but I can read the law and I can understand what it says. And in that regard, they are supposed to be helping develop the IEP. They are supposed to be providing input that is heard and listened to and taken seriously. And one of the things that as a master IEP coach that I've learned to do is to help parents write what's called a parent input statement. And that helps get the parent's voice on paper even before the meeting starts. And then they can send that into the IEP meeting ahead of time to the school psychologist or whoever writes up the IEP in their district, and have it included directly into the IEP. So their voice is right there in black and white, and it won't get forgotten because it will be there. And then they have the opportunity to read that at the meeting or have someone else read it. And then it can be discussed, because oftentimes what a parent wants is not the same thing in the same way that the school wants. Everybody wants the child to be successful, but successful is one of those words that people have a different idea of what successful looks like and what successful means. For many, many parents whose child has the need for special education, they have more of a desire for their child to have friends and to be socially accepted than they are worried about their academic levels. Now, a school, of course, is going to be worried about their academic levels. So the school's approach to making the child successful is getting as much knowledge in, getting as much content in, getting as much academia in as possible. But when you start to really think about that, an IEP is to prepare the child for further education, employment, and independent living. So what does all of that say? Life outside of school, basically. So when you're thinking about that and thinking about, well, what do we all do? We're social creatures when we're adults. We're interacting at work. We're interacting at our churches. We're interacting in restaurants. We're interacting at with our people who we live with, whether that's a spouse or children or just college roommates or whomever it is that we are living with. We're communicating. We're being social. Yes, there are some things that we need to know academically, but oftentimes it is more that social aspect. Not always. And again, that's why it's important to A, think about the individual, and B, hear what the parent has to say, and then collaborate with everyone on the team. There isn't supposed to be the school side of the team and the parent side of the team. It's supposed to be one big collaborative team. And let's all remember that the person that we're there for is the student for whom we're writing the IEP. And hear everyone, and especially parents' job is to amplify their child's voice that IEP is being written for. So suggestions for your parents that are listening whose children have IEPs is to write that parent input statement, and you can contact me and I can help you do that, because there are kind of good templates to use. You don't want to make a 3-page parent input statement. And there are things for you to consider when you're writing that parent input statement. But then also, if there are teachers listening, make sure that you are including those parents in the entire process of writing the IEP. And everyone remember for whom that I stands for in the IEP.
Wonderful advice. If I could
every time I speak, you take this big sigh when I'm finished.
me, it's so lovely to sit in a panel with intelligent, articulate women who are passionate about their subject. For me, passion is the greatest joy in life. I don't care what people are passionate about. Anything will do, but it's a joy. And also I'm learning, because obviously I've been around a long time. I'm 71, so I've seen a lot of life. I've experienced a lot of life, but I don't have an academic background. So to listen to you ladies talk in a very academic way, but actually reiterating all the things that I've always felt in my heart, but have never been quite brave enough to articulate, because I'm not well educated. So it's, for me, that's why I keep going, wow, because you're just saying what I've always believed. So it's very wonderful to hear. And also, if I could just say about the importance of talking to these children. On a slightly different note, I had two very big incidents in my life where my niece developed Batten disease, which I don't know if you're aware of it. It's a ghastly, horrible disease that, you know, she died when she was 14. And my dad had a massive stroke about the same time. So both of them suddenly became unable to communicate in any way. And I was horrified that virtually everybody suddenly, just like they didn't exist anymore. They'd both been very intelligent, articulate people. And suddenly they were kind of shoved to the corner of the room and, oh, we don't bother to talk to them because they can't respond. And so because I'm a little bit like that, I forcibly spoke to them both at different times, constantly. And you get a response. I mean, I can remember one time my little niece, I was caring for her, and she was in a wheelchair by that time, couldn't talk or anything, but was still able to function a bit. And I took her to the bathroom, and she just, for her, I don't know, 13th birthday or something, she desperately wanted pierced ears. She managed to persuade my sister, despite the fact she'd lost most of her faculties. She was very strong, and she kept going like this. So in the end, just really to shut her up, they got her ears pierced, which I didn't approve of, but she was very happy. She had these tiny little diamond studs, tiny. I took her to the bathroom. She was sitting there, and of course she just was for a long time, and I was sitting on the floor. She was much taller than me by then and very strong. And suddenly she started fiddling with her ears, and then she just went like this and burst out laughing. And I said, Yvonne, you've dropped your diamond earring down the toilet. And she just laughed and laughed and laughed. She couldn't communicate, but it was, I mean, this was 15 years ago, and it still makes me cry thinking about it. But it just made me, and my father, he could do nothing. He couldn't move or eat, or it was just awful for 6 months. But I remember once sitting talking to him, and I started talking about his parents, my grandparents, who were long dead, and the tears were pouring down his face. And for me, those two things just prove what you say. It's so incredibly important to talk to people, but so many people don't. They just think, oh, they're just shells. They're not worth talking to anymore. Okay, enough of that. Sorry, I've diversified, and I'm sorry. Shoshana, your book is recommended as a great tool for not just parents and practitioners, but for teachers as well. What are some of the suggestions that teachers can take away from your book?
Well, I think I'm going to modify. Once again, I'm going to modify something here, Pat, and I hope that's okay. And talk in a sense about not so much, yes, teachers. I think teachers as practitioners, under that umbrella word that's in the title, the long title of the book, can take away, similar to practitioners, sort of, I hope, a new understanding of how we look at autism, a more critical thinking of how we diagnose, and being more aware of what we need to do to really reach the child. I wrote it, if I can, Shelley, how did you call it? Shamelessly
plug.
Shamelessly plug it. Here's the baby, my legacy to the field. And basically I called it a casebook because I wanted the stories. I didn't want to start off with theory. There is some theory in it, but there are about 8 cases right off the bat. Bam, 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 bam. The first 8 chapters are all stories because I wanted parents and teachers and paraprofessionals of all kinds, professionals of all kinds, therapists of all kinds, university educators, and so on, to say, wait a second, how did that child came with an autism diagnosis and they went to that? What made that happen? How come? How come they had a DSM-4 or DSM-5 diagnosis and they went on to do such and such? Well, what's that all about? Later, I do put more how-to in it, but even it's very, very accessible. So there's a lot about questioning the diagnosis. There's a lot for practitioners about reflective practice. And I think too, it'd make a really, really interesting source book for university instructors who are, say, teaching the book, say, teaching the DSM, teaching by a diagnosis, telling these young people, these future practitioners of the world, all the, all the technical stuff they need to know. But if you really want to make a difference in children's lives, you better be able to see the child behind the symptoms. Because if all I would say to the parents, I would put them at their ease, because I could see so much beauty and so much strength and so much potential in their child, because that wasn't just me. That's the way we worked at the Institute. I was working with a whole team of people like that, like yourself, Shelley. And if you don't see that, you've done an extraordinary disservice to the child, and to the family for that matter. So I wanted the stories to tell, and I think it would make a really good sort of like antipasti, I think it'd make a very good source book for young students in college to see what's it like out there in the field. Oh, this kid comes in, oh, I got a name for it. I know, it's autism. Well, it's very easy to give these days because it's all elastic, right? No, what do you do with it? Is it really autism? Is that really what you found? And these are really important questions, I think, for the parents in terms of what, and so far the feedback that I've gotten, thankfully, is confirming that, is a sense of hope that they too don't have to see the diagnosis of their child as a determinant. And that once you start to work from a more hopeful place, guess what? You get better results. Things start to move. So
yeah, and hopefully more and more people will be able to have access to this book, because it's important.
It's important. It's very important. Yeah,
Very important.
yeah. Pat, you were saying before about, university background. You didn't have a university background. Well, sometimes a university background is great. And sometimes it puts certain formal blinders on you. So you got to be, it helps, but you got to be aware of what's happening to you.
Yeah.
Yes.
Pat is brilliant.
I'm not sure. I don't know if it's brilliant, but it's learned through life. I learned much. I learned much more on the floor with the kids than I did in textbooks, and seeing the symptoms is just. That's not the end of the story. That's just the beginning. Okay, I saw the symptoms. Now what? I used to tell parents. I must share this with you. I used to tell parents who were feeling so hopeless, say, yeah, okay, I see your child's symptoms, but I see more. I said, excuse me, but the cleaning lady could come into my room right now and have a look at your child and say, that child's not talking. That child doesn't have very good eye contact. I said, I want to see more than that. I want to see the spark in your child. I want to get in there and create change. So I hope that answers the question. I'm hoping the book will make waves.
Yeah, thank you very much for your response. And Shelley, can all schools use IEP? IEP, sorry.
Yeah, absolutely. I mean, here in the United States, it is mandated, but I mean, across the world, you can write up it. I mean, if you just think about what the letters stand for, individualized education program. When I was in the British school, when we lived in England, I was able to volunteer. And in a way, the classrooms that I was in, they kind of already did that without actually having a formal document. It did seem in the country day school that I was in Erith. I don't know if that was where anywhere near where your small town is that you grew up, Pat, but I was in Cambridgeshire. And it did seem like their education was much more directed per student than a whole class. And yes, like I said, it's a very formalized document here in the United States, and there's a whole process that kids go through. Not everyone gets qualified for special education if they're having learning difficulties or learning differences. There is a criteria that has to be met, but it is certainly something that you can think about for individual children, no matter where you are in the world, that this particular student isn't learning in the same manner as the rest of the kids their age or in their classroom. So what can we do for this one student to help that student reach their fullest potential? And then you can, if you want to write something formalized, you can, thinking about, what does the student already know? What are the student's strengths? Where do we want the child to be? What kinds of things can we work on with that child? So what kind of goals are we going to put in place? We call it specially designed instruction here in the United States. That's what gets written into the IEP. What kind of specially designed instruction might this student need in order to fill in any gaps, or in order to help them understand this a little bit better, or help their behavior? One of the great stories, and it's kind of the pivot point for me, is in, again, my story in the book, is working with a child who had very severe unwanted behaviors at the beginning of his kindergarten year. And by the end of that year, we rarely saw any unwanted behaviors. And it was because we were consistent. We worked with the whole child. We didn't just say, well, this kid has behaviors, let's just get these behaviors tamped down. No, we figured out, what were those behaviors communicating? What is this child trying to express? What is this child maybe missing as far as skills go? What is this child missing as far as maybe consistency or structure or sensory? Or, I mean, we really looked at the child as a whole person, not just this one tiny aspect of who this child was. And that's what I did from that point forward, and with all of the students that I ever worked with in my own classrooms, but how I work with them now as an IEP coach is, what is this behavior communicating? What is the skill deficit? What is needed for the individual? And Pat, I want to also, when you were saying that about, I don't have I didn't go to university. All that the real difference between Dr. Shoshana and myself and Lucia, of you not going to university, is we've paid to have some extra letters behind our names. But you've gone to the University of Life. And so, as Dr. Shoshana said, you learn so much on the job, in any job that you're in, that just because someone has those extra letters behind their name does not make them in any way, shape, or form a better equipped person to do anything. So please don't ever consider yourself just somebody.
Yes.
Thank you. That's very kind of you. I think part of my reasoning for that, because I know in my heart that I'm reasonably bright. I can do this. But I've lived with three men, two of whom I was married to, all of whom were teachers, all of whom used to say, "Oh, it's such a shame you didn't go to university," but in a rather degrading manner. And so yeah. I guess all my whole adult life, because one I was married to for 14 years, I lived with another one for 4, and then 26 for the last one. So collectively, most of my adult life, I've kind of been made to feel a bit second rate because I didn't go to university. So when I was 45, I had my daughter at 43, my only child, I thought actually, I want to know if I do have a brain, because it kind of got into my head, maybe I'm smart at all. So I signed up for an Oxford Open Learning A-level course in English language, English literature and language. And it was a 2-year course and I did it in 4 months. I sat up day and night doing it and passed. And so I thought, okay, I have got a brain. Now I can put that to rest and just get on with my crazy. How people can make you feel, which I think is why I feel so strongly about what you ladies do, that you're making a difference to kids' lives. And that is a huge, huge, huge thing. Because if someone had told me when I was a shy little 15-year-old who was bullied at school and, you know, I was poor. I was the poorest one because I was quite bright. I was the poorest one in my class. So I kind of had secondhand uniform and stuff, and kids are horrible to each other. But if somebody like you had said to me, don't worry, Pat, it doesn't matter. You're going to get to the age of 71. You're going to be a published author. People are going to think you're quite smart. None of that matters. And in a way, that's exactly what you ladies are doing. And that's why I'm so full of admiration for you. So thank you. And now our final question, and I guess we have to be a little bit short on this, do we, Lucia, because we've gone a bit over time. Shoshana, unfortunately, there's still the possibility of being viewed as less than, which we've talked about in depth already, as being viewed as less than in society when it comes to neurodivergence. What do you have to say about that? Is there any more? I'm sure there is.
Oh, okay. Tons and tons and tons. Just a little aside. I promise. I'll try to make it really, really, really short, and then I'll answer your question. But I don't even use the word. It's an open secret. I don't use the word neurodivergence. I don't use the word neuro. That's okay. Don't have to. No. You can use it. Everybody else is using it. There are many reasons why I don't use it. It doesn't help me as a psychologist. I just want to sort of be congruent with myself, and just let you know, for me, it's still the good old-fashioned children with special needs, and then I keep sight of the child, and then we got these need parts that we're going to work on and help the child with. It's different, very different model, working from a very different model. Anyway, I think I can answer this question by telling you a little bit about the Feuerstein Institute and the inspiring place that it was. And in terms of how society looks, he was a pioneer. Now you're asking me, and he's no longer alive, but this was the inspiration, and it had impact on every single kind of population that came to the Institute from all over the world. And for example, pioneering work in the field of Down syndrome, who were, as someone said earlier on in this conference, institutionalized in the old days. You never saw them. Packed away. He pioneered, along with his workers, getting them integrated as much as possible, included in Israel's school system. When I joined the Institute, I understood once I was there in 1992, why was he eager to have me? Because he was eager to take the same pioneering spirit into the field of autism. With the Down syndrome children, just as an example, in terms of not people with special needs, whether it's children or adults, not being less than, challenged maybe, but not less than, he was committed to starting programs to prepare young adults with special needs, whether it was an autism diagnosis, Down syndrome, in a wheelchair, for marriage preparation courses, and it's still going. It's a very, very successful program where special needs couples. He was insistent that those who were capable of an independent or a semi-independent life had the right to marry, with all that entails, a physical relationship. And sometimes they needed other supports and so on. So I've been brought up, so to say, professionally in an atmosphere where that's not our language. It wasn't our language. It's not my language. And just one thing about inclusion, we fought like tigers at the municipal meetings for school placement of children with special needs in Israel. Classic catch-22. By law, children with special needs can be in regular classrooms. There's only one problem. There's no budget for the aides and the small classes that requires. So a parent can have the right to request it and to demand it. And guess what? There's no budget for it. We can't do it. So we still fought for it. We became masters, my colleagues and I, at finding creative ways, recommending, creating something from nothing, really, because the resources just weren't there. And I don't know whether it's improved at all. I rather doubt it. So yeah, that's not part of our lingo, that those people are less than. Just does not compute.
So thank you very much. And now the last question is for Shelley. So you push for inclusion, so I'd love to hear what you have to say about that.
Well, inclusion is truly welcoming the whole person into the classroom, and involving them in as many activities as possible. And I say classroom, but in life. As you mentioned, Pat, your dad and your niece, why were they suddenly excluded? It was because they were different, and your other loved ones in your family suddenly became uncomfortable because they didn't know how to communicate anymore. And I really think inclusion is a lot about getting past our own uncomfortableness and reaching out and expanding ourselves to welcome somebody that is learning differently than us, or is just different than us in any way, and getting to know that person. Again, I'm going to focus back on that individual, getting to know that individual and what makes that person unique. Every one of us on this panel are unique. What makes each of us unique? Would I have necessarily, met any of you outside of this forum? Probably not. But what a great, as we mentioned before, this is such a great pairing of a grouping. It's not a pair because there's four of us, a grouping of people. And I don't know that, I necessarily, we're all different ages, we're all different occupations, we come from different parts of the world. But had I not been open to meeting you, to coming on the Relatable Voice, to being on here, the wealth that I have gotten from this conversation is immeasurable. And we miss out on those daily experiences because we exclude for whatever the different reasons are that we are constantly excluding. Just bringing someone and setting them in the environment where other people are is not including them. I mean, Pat, your story just was perfect example of this. Your father and your niece were there, but they were not included with the family. Being the one to set the example, go over and welcome the person into the flock, so to speak, and talk with them, communicate with them. Communication is more than just talking. We didn't really get into that. But like you said, your dad with the tears, you knew that he understood what you said. He was communicating to you. In fact, I think the statistics or the percentages for communication it's like 93% body language and tone of voice, and only 7% of the actual words that you speak are how you communicate. So we all have different ways of communicating, but going back to the inclusive part is learning that stuff, learning how someone communicates differently, learning how they learn differently, learning what their interests are. Take the time and just get to know other people for who they are and not focus on whatever that thing is that you were going to exclude them for in the first place.
Not a big sigh required.
Oh,
Oh, ladies, it has been such a joy. Very sadly, we've come to the end, and this is actually our final interview of the 2022 book fair, which I'm very sad about because I have met so many fabulous people, and now you ladies have just been kind of the icing on the cake because I've been able to share some quite personal stuff with you, which I'm felt comfortable to do so, which I don't with everyone. So thank you so much. And I would just like to say, I'm putting in some words here, Lucia, sorry, that I probably shouldn't. I write mostly historical fiction, and I would just think how very incredibly proud our ancestors would be that we 4 women are sitting here in a public forum expressing our views, very well-educated women. It's what they would have dreamt of. Their wildest dreams would not have allowed them to do that. Whether my ancestors were all poor, but so they were all very hardworking. Other people's ancestors were wealthy, but none of those women really had any rights. You know, not until those brave suffragettes got going. And I just think the women I write about would be so excited to see us in action. So we're doing it for our ancestors, really. So thank you so much. It's been an absolute joy. And I'll just pass it over to Lucia to finish off now. Thank you.
So I would like to thank our amazing guests for joining us today, Shoshana and Shelley.
Thank you so much, Lucia and Pat. Really delightful.
Yes, thank you. It's been wonderful.
Yes, I'm so happy to have you here. And actually, we think alike. Communication is very important for those kids. And yeah, that's what I was sure that this panel would be very special. I wish we can gather together again. And I would like to tell you that we will have all the information for our listeners, for our audience. We will have all of the information available on our website, so you can find more about their books, about a little bit about our special guests. And thank you so much for watching the RV Book Fair 2022. And stay tuned next year, and happy reading.